important facts about breast cancer which you should know. Hello everyone, I am Dr. Mansi Chowhan, Consultant Surgical Oncology at CK Birla Hospital. So the most important fact about breast cancer which everybody should know is that it is the most common cancer in women in India and across the world. And it can happen at any age, from a starting age of as low as 20-25 years to a lady which is around 70-80 years. So there is no lower age limit cutoff for breast cancer. The second most important fact about breast cancer is that it can be found as more than just a lump in the breast. There are many other symptoms which could be indicative of breast cancer, like changes in the skin, changes in the nipple area, nipple discharge, some swelling, and many others. A symptom for breast cancer can happen apart from any symptoms in the breast. That is, there could be a swelling or a lump in the armpit or axillary region, that is called lymph nodes, or there could be some swelling or lymph nodes in the neck region. Another important fact regarding breast cancer is that family history is not the only risk factor. In fact, only 15 to 20% of cases of breast cancer are hereditary or familial. Rest other risk factors are environmental or related to lifestyle. Another crucial fact about breast cancer is that mammography or breast screening is actually magical. And why so? Because by screening females who do not even have symptoms for breast cancer, we can diagnose this disease at a very early stage and hence achieve higher cure rates. Hence, it is very important that each and every female after an age of 18 years should undergo an annual screening test depending upon the age and circumstances. Only biopsy is confirmatory for this disease. Not even FNSE, not mammography or any other screening test. Any other breast imaging can tell you that this lump looks like a suspicious lump, but only by a needle biopsy can a confirmation of this diagnosis be done. Breast cancer is very much treatable and curable when diagnosed at a very early stage with the survival rates of as high as 95%. So when you hear that once diagnosed with breast cancer, you have to actually live with the disease is not right. Once diagnosed at a very early stage, you can actually be cured of this disease and live a normal life as anybody else. An important fact which only a few people would know about this disease is that breast conservation surgery, that is, only removing the tumor and not the entire breast, is a surgery which is very widely accepted in the West, with the breast conservation surgery rates as high as 70-75%. Whereas in India, we are still catching up at a rate of around 30-40%. And the reason behind that could be lack of awareness about this procedure, lack of surgical training, and many other socio-economic factors. Breast cancer treatment is not painful, which is a very common myth around this disease. So breast cancer treatment can consist of surgery, chemotherapy, radiation therapy, hormonal therapy, targeted therapy, and none of these treatment modalities is painful. And last but not the least, we are able to achieve a very high survival or cure rates, and many patients are surviving this disease, with an approximate drop of 40% in the mortality rate due to this disease from year 1989 to 2015. However, in India, we are still fighting this disease to diagnose at an early stage, and around 50% of these patients are still diagnosed at a stage of third or fourth stage. Hence, it is an appeal for everybody that please get yourself screened, be breast aware, stay informed, and take care.